Typhus is a disease caused by one of several types of Rickettsia bacteria, which are transmitted by lice, fleas, mites, or ticks. The history of typhus is long and somewhat complex, as it was often confused with other febrile illnesses such as typhoid fever until the late 19th and early 20th centuries. The disease has likely been affecting humans for thousands of years. Historical records suggest that illnesses resembling typhus have been documented since the Spanish siege of Granada in 1489. However, it's difficult to be certain about these early accounts, as the symptoms of typhus can be similar to those of other diseases. The term typhus itself comes from the Greek word typhos, meaning smoky or hazy, describing the state of mind of those affected by the severe fever and delirium that can accompany the disease. The distinction between typhus and typhoid fever was not clearly understood until the late 19th century. The discovery of the causative organism of typhus, Rickettsia prowazekii, was made by Howard Ricketts in 1909. This was a significant milestone in understanding and controlling the disease. The development of an effective vaccine and improvements in public health and hygiene have significantly reduced the incidence of typhus in many parts of the world, although it remains a concern in areas where access to clean water and sanitation is limited. Typhus is an infectious disease caused by Rickettsia bacteria and transmitted by different types of vectors, primarily lice and fleas. The disease manifests in two main forms: epidemic, louse-borne, typhus, and endemic, murine, typhus, each with distinct transmission routes. Epidemic typhus, louse-borne typhus, is caused by Rickettsia prowazekii and is typically transmitted through the human body louse, Pediculus humanus corporis. The transmission cycle begins when lice feed on the blood of an infected person. The bacteria do not spread directly through the louse bite. Instead, the route of infection is indirect. When a person scratches a louse bite, they can inadvertently rub louse feces, which contain the bacteria, into the wound or onto mucous membranes such as the eyes, nose, or mouth. Epidemic typhus is most prevalent under conditions where people live in close, crowded quarters with poor hygiene, which facilitates the spread of lice. This form of typhus has historically been a significant problem during times of war and famine. Endemic typhus, murine typhus, on the other hand, is caused by Rickettsia typhi and is primarily transmitted by fleas, with the rat flea, Xenocilla cepis, being the most common vector. Other flea species, like those infesting cats and opossums, can also transmit the disease. In this case, the bacteria are again not transmitted directly through the flea bite. Instead, the infection occurs when flea feces are scratched into the skin or come into contact with mucous membranes. Rodents, particularly rats, are the primary animal reservoir for Rickettsia typhi, but other animals can also harbor both the bacteria and the fleas that spread it. In both forms of typhus, the bacteria enter the body and infect endothelial cells within the vascular system. This leads to widespread vascular damage, which is responsible for many of the symptoms of the disease, such as rash, fever, and headache. Prevention strategies for typhus focus on maintaining good hygiene, reducing contact with vectors like lice and fleas, and controlling rodent populations in areas where the disease is endemic. While vaccines are available for epidemic typhus, they are typically reserved for use in areas where the disease is common or in specific high-risk situations. Typhus, a disease caused by Rickettsia bacteria and transmitted by lice or fleas, manifests a range of symptoms that typically begin within 1 to 2 weeks after exposure to the infected vector. The illness is characterized by several key symptoms. One of the earliest and most common symptoms of typhus is a high fever, which is often accompanied by chills. This fever can be quite severe and persistent. Patients with typhus frequently experience severe headaches, which can be among the more debilitating symptoms of the disease. A notable symptom of typhus is the development of a rash, usually appearing around 4 to 7 days after the onset of fever. This rash typically starts on the trunk and then spreads to the limbs. It is often more pronounced in cases of epidemic typhus and may become widespread, covering much of the body, though it usually spares the face, palms, and soles. Muscle pain, myalgia, and general body aches are common, adding to the overall discomfort of the illness. Feelings of general discomfort, unease, or fatigue are frequently reported by those suffering from typhus. Some individuals with typhus may experience nausea, vomiting, and abdominal pain, though these symptoms are not universal. A cough may develop in some patients, although it is less common compared to other symptoms. In severe cases, particularly with epidemic typhus, patients may exhibit neurological symptoms such as confusion, stupor, or seizures. These symptoms indicate the involvement of the central nervous system and signify a more serious progression of the disease. The severity of these symptoms can vary significantly. Epidemic typhus, which is transmitted by lice, is generally more severe and can be life-threatening, especially in older adults or those with underlying health conditions. Endemic typhus, transmitted by fleas, tends to present milder symptoms. Prompt medical attention and treatment with antibiotics, such as doxycycline, are crucial for a positive outcome. Without timely treatment, typhus can lead to severe complications and even be fatal, particularly in the case of epidemic typhus. Treating typhus effectively involves a combination of antibiotic therapy and supportive care measures. The primary treatment for typhus, which is caused by Rickettsia bacteria, is antibiotics, with early diagnosis and prompt treatment being crucial for a successful recovery. The antibiotic of choice for both epidemic and endemic typhus is doxycycline. This medication is effective against Rickettsia bacteria and is typically prescribed for a course of 7 to 14 days. Doxycycline is suitable for use in adults and children, including those under the age of 8, in situations where the risk of typhus is greater than the risks associated with the use of doxycycline. For patients who cannot take doxycycline, such as pregnant women, chloramphenicol is an alternative. However, it is less commonly used due to its potential side effects. Alongside antibiotic treatment, managing symptoms and supporting the body's recovery is vital. This includes the management of fever with antipyretics like acetaminophen or ibuprofen, ensuring adequate hydration, especially in cases of vomiting or high fever, and encouraging rest to aid recovery. In severe cases, particularly with epidemic typhus, hospitalization may be necessary for closer monitoring and management of potential complications. Severe dehydration, neurological complications, or organ failure require specialized medical care. Good nursing care and maintaining hygiene are important, especially for hospitalized patients, to prevent secondary infections. Treatment of typhus also involves addressing the source of the infection. In cases of epidemic typhus, this means delousing, while in endemic typhus, controlling flea infestations is crucial. In outbreak situations, public health measures may be necessary to control the spread of the disease. It's important to recognize that typhus should be treated as a medical emergency. Delayed treatment can lead to serious complications and increase the risk of mortality. The use of antibiotics has significantly reduced the mortality rate associated with typhus, but prompt medical attention is essential for a favorable outcome.